And welcome back to The Factor Uncensored. Another warning about the dangers of plastic surgery, specifically the BBL that many of you know, that butt lift. An MD next to someone's name does not mean they are necessarily trained to perform a plastic surgery procedure. And even worse, that kind of information can even be concealed from patients out there. So some non-doctors who are not trained could find a way to perform a procedure which could end in disaster or worse, even death. Surgeon Dr. Kutty joins us here on The Factor Uncensored. You have been blowing the horn, the alert about this. You've been telling your other colleagues around the country and in hospitals that this is dangerous. Tell us what you have seen as a result of individuals who have performed, like, for example, the Brazilian butt lift without proper training that you have.
There's actually a very good example. It happened not too long ago where a woman had that procedure that you're talking about. And it was done by somebody who was actually a dentist who clearly should not have been doing this kind of surgery. And she ended up having some pretty serious infections, had to be taken to the hospital, had to have a lot of corrective surgery done, came near death. And as far as the last I heard, she had survived. But that kind of danger exists not only with that particular operation, but with lots of different operations. So you don't have to be, at least in the state of Texas, you don't have to be a plastic surgeon to do plastic surgery operations, and that's something the public just doesn't realize. You know, you go to see somebody who says they do cosmetic surgery, you don't know that they may be a pediatrician, they might be a family practice doctor, they could be anything. They may not be a plastic surgeon at all. And that's the kind of thing that I'm hoping to get the message out, to let people know they really need to be aware that this happens, and they have to find some way to vet the person that they're going to see.
Do you think the state should change the rules and the policies and laws when it comes to who can do this type of procedure, especially plastic surgery? You went to school for plastic surgery. That's your specialty. Now, why would you go to a dentist to fix your ass?
Because you didn't know it was a dentist.
That's a problem.
That's the thing.
Disclosure.
There's no way for them to know. They're not going to say that, you know, if I'm a family practice doctor and I go and learn how to do, you know, some operation, I'm maybe learning that in a weekend course, which actually exists. There are 2-day, 3-day courses where you can learn dozens of plastic surgery operations.
Is that all you need?
No, it's not all you need, but you can get away with that.
That's what people are getting. Okay.
Yeah, so you can do that. You can go to a course. And in one of the talks I gave, I showed them what the itinerary of the course was, and it was 2 days, and there was a 15-minute segment on patient safety. And that's the real problem, is that they don't know how to do these operations safely. So, you know, I spent years learning how to do these things, and not only learning how to technically do the operation, but to do it safely. And it doesn't matter if you have a great result if you don't survive the operation, and that's the kind of thing that can happen. There's a lot that goes into knowing how to do these operations safely. But you cannot learn liposuction and a facelift and breast augmentation and I don't know, there's dozens of operations that they teach, but you cannot learn all of those things in 2 or 3 days. It's just not possible. But the average person who wants a cosmetic surgery operation, who looks online and they see cosmetic surgeon, will think that person's a plastic surgeon, but that's not the case at all. It may not be a surgeon at all. You know, you could be a family practice doctor, family practice, obstetricians, pediatricians, all kinds of non-surgical fields as well go into doing these kinds of things because they're lucrative.
All right. Dr. Kutty in Sugar Land, thank you for joining us and ringing that alarm for the viewers out there. Still to